As cases continue to rise and Omicron spreads, there are a lot of questions out there about what to do this holiday season.
Dr. Hakeem Adeniyi joins us now from the Native American Health Center. So, Doctor, let's start with Omicron and some of the latest research that we know about this, because it sure seems from our reporting that a lot of vaccinated people are getting infected right now.
So we are starting to note that Omicron is more contagious than some of the previous variants that we've seen before. We are seeing that those who have been vaccinated can still get COVID-19, but we still are noticing that those who are unvaccinated are at significantly higher risk of having poor outcomes, whether that be hospitalized and the chances of death. So while people have been vaccinated, can still get it to a certain extent, they don't tend to be nearly as sick, end up in the hospital, and we haven't seen people die as a result of it if they've been vaccinated and appropriately boosted.
And Governor Newsom announced today that California is requiring booster shots for healthcare workers. What is the goal here? How is this going to help the state of fighting the virus, and why are they starting first with healthcare workers?
So excellent question. Part of it is to ensure that we have a healthcare force. Many of us received our vaccines, our first vaccines, more than 6 months ago. I know I received my first one in December, my second one in January, and then I got the booster when it was available to me. Since it's been more than 6 months for so many people, that's when we tend to see those who are vaccinated have higher risk of getting COVID-19. So that's part of the reason why we're doing it. We want to decrease the burden within the healthcare system and also ensure that we're available to continue to serve our communities and populations.
So, Doctor, we know a lot of people are going to be gathering this week for either travel or a party, things like that. What are some of the best ways to reduce risk? Maybe some things that are a little we haven't thought of or talked about before.
So another great question. We definitely want to continue to follow the same guidelines that we were following before in terms of masking, physically distancing, washing hands. If you have any symptoms, taking them very seriously. I know for myself, one of the things that we've been doing, all of our eligible individuals have been vaccinated and boosted, but we're still testing beforehand, a couple days beforehand, using an antigen test and testing the day of to ensure that we aren't increasing our risk of infecting those that may be a little more immunocompromised. So those are some of the things that I think would be really helpful.
And we have one more question for you. We've heard that a lot of these at-home tests are being sold out at pharmacies and other healthcare providers. What's your best advice if someone wants a test but they can't get their hands on one and maybe the wait is too long? What can they do?
Yeah, it's a million-dollar question. I know that there are a number of individuals and a number of community organizations and other locations that are providing tests. One thing that can be done is calling the local county Department of Health to see where tests are available, or calling 1-833-422-4255. I know our organization has been a testing site on Saturdays where we've been able to test a number of individuals that needed the test in a short period of time.
Okay. Doctor, thanks so much for your time and your expertise. We appreciate it. We know our viewers do as well. Thank you.
Oh, thank you.